Welcome to the ADI Masterclass on the Global Dementia Action Plan. My name is Katrin Seeher. I'm one of the technical officers at the World Health Organization working in the area of dementia. It's a great pleasure for me to record this masterclass for you. This masterclass has three parts. I will give you a brief introduction to the Global Action Plan on the Public Health Response to Dementia 2017 to 2025. That's its actual official title. I will talk a bit about the tools and resources that we have been or are currently developing at WHO to help our member states in implementing the action plan. And then in part 3, we will look at what has happened in the last year, where do we want to be, and finally also discuss a few ways in which you can get in touch with WHO and drive action in your countries. So let's start by looking at the Global Dementia Action Plan. You can actually download a copy by scanning this QR code here on this slide. The Global Dementia Action Plan is best viewed in the context of other global roadmaps because it links to and complements other commitments, such as, for example, the UN Sustainable Development Goals and the principle of universal health coverage. Because of shared risk factors, dementia also links very strongly to non-communicable diseases and actions taken at the highest UN level and also WHO to manage, prevent and treat NCDs. The Dementia Action Plan also strategically links to areas such as mental health, disability and aging. And in some countries, in fact, national dementia action will occur under the umbrella of one of these areas rather than on its own. Other linkages include the global strategy for workforce, or last but not least, regional or national dementia plans that might exist. So together, all these roadmaps and plans provide the kind of holistic approach that would be needed to address the issues associated with dementia. After this initial context, let's now look at the Global Dementia Action Plan in a bit more detail. What does it actually want to achieve long-term and short-term? The plan envisages a world in which dementia can be prevented, ultimately. And until that's possible, people with dementia and their care partners can live well and receive the care and support that they need to fulfill their potential and live with dignity, respect, autonomy, and equality. That's more of a long-term vision. The more short-term goal is to start right now, improve the lives of people with dementia, their carers and families, while at the same time decreasing the negative impact that dementia might have on communities and countries and societies. There is a set of 7 cross-cutting principles that runs through the Global Dementia Action Plan, a bit like a red string. These are principles that matter for every aspect of the plan, and they include human rights, equity and empowerment, universal health and social care, multi-sectoral collaboration, because no matter which aspect of dementia we're looking at, not one single sector will be able to address all the issues alone. And finally, everything we do needs to be based on evidence, and we cannot focus our attention only on finding a cure. We also need to prevent dementia and care for those who are already affected. This slide now summarizes all the main parts of the Global Dementia Action Plan in just one page. That's why it's so busy. But it contains the 7 strategic action areas and their associated global targets for 2025. It also outlines all the major actions that are recommended at country level under each of the action areas. So for example, for Action Area 1 on the left, making dementia a public health priority, you see the global target is 75% of WHO member states have a national dementia plan. To reach this, we have a long way to go. So you see, the global targets are very ambitious, but they're also meant to drive action, to push us collectively, not just member states, not just WHO or civil society, to push all of us. For Action Area 1, you then also see that the recommended actions at country level would be to have a national dementia plan, to review or revise relevant legal frameworks, and to allocate financial resources to support that dementia work. There are also recommended actions for countries to improve dementia awareness and friendliness, to drive dementia risk reduction and link it up with NCD risk reduction programs, for example, to increase the diagnostic rate for dementia and improve treatment, care and support for people with dementia and their care partners. There are also actions that enable countries to monitor the dementia situation better. And lastly, there are actions to strengthen research and innovation in the area of dementia. Compared to other diseases that pose a similar burden like dementia, we only produce a small fraction of research output on dementia. And countries also invest very little in dementia research compared to other conditions. So it takes us longer for breakthroughs to occur, and it also takes us longer to implement innovative, positive results or new findings into practice or daily care. The action plan tries to change all of this or give impetus to change this. You also see on this slide that underlying all of this is the Global Dementia Observatory and its 35 indicators that monitor all actions across all these areas. But more about the Global Dementia Observatory and other WHO tools in the second part of this masterclass. So in part 2, we now look at WHO tools and products that can help member states in implementing the Global Dementia Action Plan. On this slide, you see the same 7 action areas that you've seen before. But next to them are now tools and products that we are working on or already implementing with countries. Over the next few minutes, I will introduce each of these tools very quickly. So firstly, to support countries in developing national dementia plans. WHO released a guide called Towards a Dementia Plan, a WHO guide, in May last year. The guide walks you step by step through the process of creating a national dementia plan. A link to access this document online is here included at the top of the slide. One important step in the policy development is always understanding the country situation. And this part is very closely linked to the Global Dementia Observatory. In fact, often countries that are using their participation in the Global Dementia Observatory as a starting point for developing their national dementia plan. So that's why this policy guide is designed so that countries can use it side by side with the GDO. Action Area 2 is about dementia awareness and friendliness. To support countries in becoming more inclusive and friendly for people with dementia and their carers, WHO is developing a dementia-friendly initiatives toolkit. In 2018, we conducted a large stakeholder consultation, and based on those results, we revised the framework on which the DFI toolkit is based. This framework you see on this slide, and it can be used for developing and implementing a dementia-friendly initiative, but it can also be used to monitor and evaluate existing dementia-friendly initiatives. We also asked people with dementia what they would expect that a successful or meaningful dementia-friendly initiative would achieve for them. And their ideas are reflected in our definition of a dementia-friendly or inclusive society now. The toolkit is currently under development and will be shared for comments and inputs in the near future. In a couple of weeks, WHO will also be launching the first dementia risk reduction guidelines. They've been developed with a large group of international experts and summarize the currently available best evidence for dementia risk reduction. The recommendations can be split into lifestyle interventions and treatment or management of health conditions that are known risk factors for dementia. After the launch of the guidelines in mid-May, you will be able to download a copy from our department website. To improve the diagnosis, treatment and management of dementia in the community, we have one very powerful yet underutilized tool, the MH-GAP Dementia Module. MH-GAP, or Mental Health Gap Action Program, is a set of evidence-based guidelines, training packages, implementation tools, even a smartphone app for priority mental health, neurological and substance use conditions. And dementia is one of them. It teaches non-specialist health professionals how to identify people, for example, with dementia in the community, and then how to manage their condition. MH-GAP is used in many parts of the world, but like I said, the dementia module is not widely used yet. With the Global Dementia Action Plan as our mandate, we are now working with countries on changing this. In many, if not in all countries in the world, dementia carers, so the family members and the friends, build the cornerstone of dementia support. They provide the bulk of care and are mostly doing a tremendous job. But we're often leaving them alone. No one is born to be a dementia carer. People need to receive training and support so that they can provide care for their loved ones. WHO's iSupport does exactly that. It's an online training program for dementia carers. In 5 modules, it teaches the user what dementia is, how to be a carer, how to look after oneself, how to provide actual everyday care, and how to manage behavior changes. In a couple of weeks, iSupport will also be available as a hard copy manual, so that even people without computers and internet can benefit from the program. We've spoken about the Global Dementia Observatory already and its role for monitoring the Global Dementia Action Plan. But its primary objective was actually to support countries. Knowing their situation enables countries to make better decisions and to plan for the future. It also helps them to monitor whether they're moving in the right direction. But we also wanted countries to be able to learn from each other, share good practices and new ideas. So all of that is what the GDO is really about. The framework, which you can see on this slide, consists of 3 domains: policy, service delivery, and information and research. These 3 domains are building blocks or levers that a country has at its disposal. You also see 7 thematic areas, like objectives or goals that a country might have. And they are aligned perfectly with the action areas of the Global Dementia Action Plan. And within that structure, now imagine there are 35 indicators that can measure country action across these 3 domains and the 7 thematic areas. As part of the GDO, countries are now collecting data for those 35 indicators and submitted to WHO. That information then gets uploaded onto the GDO data portal, and you can actually see a screenshot of this here. We also produce country profiles that summarize the country situation and may help identifying gaps and priority areas for action. And you see an example of a country profile here. As I said before, aside from collating data on those 35 indicators, the GDO also wants to enable exchange and sharing of information. This is done through the GDO Knowledge Exchange platform. We are currently expanding the platform and require the support of experts all over the world in identifying good practice examples that should be shared through that knowledge exchange platform. So if you would like to join our growing network of GDO peer reviewers, please consider completing the online expression of interest form. And you can simply do this by scanning this QR code here and then complete the online form. So over the last few minutes, I've given you a very quick overview of the different tools and products that we have to support countries in implementing the Global Action Plan. But how does country activity actually look like, you might ask yourselves. Are all countries doing everything? Are all countries supposed to be doing everything? And the short answer is no. But they could if they wanted to. Together with our colleagues at country and regional level, we use a comprehensive approach based on country needs. Usually the Ministry of Health, together with the WHO Country Office, would identify the areas of need. And based on that, we would tailor the support package using our tools that can then be provided to the country. Sometimes it makes sense to bundle support for a region and host a regional workshop, like we've done in the past and will certainly continue to do. Because having these regional workshops provide great opportunities for shared learning and exchange. So let's pause here for a moment and look at where we're now and how you can get involved in the last part of this masterclass. So what has happened in 2018? On this slide, you see WHO's main activities in 2018. 2018 was actually the first full year since the Global Dementia Action Plan was adopted. So at the end of last year, 72 countries had either completed GDO data collection or were in the process of data collection. And this covered already 75% of the world population. Today, this number is even higher and continues to grow. 45 countries participated in one of those regional dementia workshops that I mentioned, and to 5 countries we had actually conducted individual country missions, mainly to support their policy-making process. 46 countries participated in consultation for the dementia-friendly toolkit. And importantly, these 46 countries covered all 6 WHO regions. So that was done so that the toolkit would be relevant not only to high-income countries, but also to countries with less resources. Also, by the end of last year, the risk reduction guidelines had been approved, which was a very important step in enabling countries now to integrate dementia into their existing NCD risk reduction programs, for example. We also at the moment have 8 countries working on adaptations of iSupport, and many more have expressed an interest. And if you want to find out more about iSupport, please by all means send us an email and reach out. We're happy to help. Finally, there were 2 consultations held in Geneva last year as part of the MHGAP Forum. They focused on the MHGAP Community Toolkit. So that's an MHGAP version for non-health professionals, if you like, and on dementia care pathways. Both these consultations were extremely useful and important because they are now driving the next steps for us in these areas as we're taking them forward. So this is what we did in 2018, but how are we collectively doing in terms of reaching the global targets? It's still a bit early days for that, and in many areas it will take more time to see action actually reflected in numbers. But it's useful still to keep track of progress and to look at numbers even that early. So I want to show you a few. Here you see a world map of countries participating in the GDO as of April 2019, hot off the press. The shades of green reflect where in the data collection process countries currently are. Countries in dark green have already submitted their data. Countries in very light green are only just starting the data collection process, while all the others are somewhere in between. And why are we looking at GDO participation first? Well, as I said before, for many countries, this is an important driver. It provokes action to start the policy development process, or start building or improving services. For example, Qatar used their GDO data collection as a situation analysis to then develop their national dementia plan, which was launched in November last year. So that was a big success. So we feel that enabling countries to have access to that kind of information is extremely important in the process of driving change and driving action. That's why we're so heavily invested in the GDO and bringing more countries on board. The other map that I wanted to show you is this one, and that contains the WHO member states that currently have a dementia plan or have recently committed to developing one. And you can see we have a long way to go to reach the target of 75% of member states. But we hope that with data collected through the GDO, we can identify gaps and develop targeted strategies with countries to address those gaps. And maybe that means integrating dementia in a meaningful way into other policies and not have a standalone plan. It does not always have to be a standalone dementia plan. Civil society can help raise awareness of dementia at government level. In many countries, all dementia advocacy started with local dementia or Alzheimer's organizations. So how can you get involved and drive that action? Well, first of all, know your partners. Who can you draw on for help and support? Then know your local champions. Are there any celebrities, any politicians, community leaders that you can draw on that have an interest in dementia? Next, know your entry points. For dementia, these include, for example, NCDs and their associated risk factors, mental health, aging, disability, general health strategies. Which of these are present in your country and how do they see dementia? How can they integrate dementia? And then lastly, know your country's strategic political priorities and then leverage them and link them to dementia. Priorities are very country specific and influence the decision-making process. It might also help to link dementia to global priorities. So for example, universal health coverage or the SDGs, human rights. All these are global, international, big commitments that if you link them to your dementia asks, will open doors. So take some time to reflect on the answers to these questions for your specific country, and then plan meetings with your partners and your local champions to discuss the entry points and the priorities of your country and how they influence or what implications they might have for dementia. And the last question of this masterclass might be, for many of you actually, how can you get in touch with WHO? For that, it's important to understand the overall structure of WHO and its 3 levels. WHO is usually represented in the majority of countries through local country offices. Every country also belongs to one of 6 WHO regions, and you can see them here on this map in different colors. Knowing which WHO region your country falls in is helpful when trying to get in touch with them. Because sometimes the WHO regional classification actually varies from the classification that others might be using, for example, ADI. So take a moment to look at this map and find your country and the WHO region. Now, the easiest way to get in touch is probably by sending an email to whodementia@who.int. This is the generic email account for the WHO Dementia team in Geneva. We have a dedicated team and dedicated team members responsible for every WHO region. They stay in close touch with the regional offices. One of us will usually forward your request to the regional advisor, who will then coordinate with the country offices. It's usually the country officers who will then establish the contact with the Ministry of Health. Unless some colleagues are on duty travel or extended country missions, this process should not take longer than a week. But be aware that though some WHO regions are very large and the local mental health teams with whom we're working with are very small. So we'll do our best to facilitate ground contact as soon as possible, but in some cases it might take a little bit longer. And to finish off, if you, through your advocacy work, have already established good relationships with your ministries or government, you can let us know and we'll feed that information through the same channels to our colleagues on the ground. Often they find that information very helpful and interesting to know as they then start their conversations with ministries of health. So I think by now you've realized how passionate we are about dementia at WHO and that we take this very seriously. This makes ADI and its member associations so great partners because I think we're all fighting for the same cause. We stand by our allies and gratefully accept any opportunity like this masterclass today to provide information about the work that we do. But equally, we'd love to hear from you. So if you have any ideas or concerns or questions, please feel free to contact us through our generic email address, whodementia@who.int. With this, I thank you very much for your attention and interest in this presentation and wish you all the very best.